In this brief presentation, we'll take a look at Medicare and the retiree. By the end of this lesson, you should be able to frame the significance of healthcare costs for the retiree, discuss Medicare insurance, parts A, B, C, D, and explain the purpose of supplemental Medigap insurance. Healthcare costs can be absolutely devastating for the retiree. Based on a 2010 study by Fidelity Consulting, it estimates that the out-of-pocket healthcare expenses for a 65-year-old couple retiring in 2010 and living for 20 years ranged from $250,000 to $430,000. That is the out-of-pocket healthcare costs over and beyond Medicare. Bob Powell from MoneyWatch estimates that out-of-pocket healthcare costs for the average retiree equals 13.2% of retirement income. Remember, Medicare only covers a portion of the retiree's medical cost. This graphic from the Employee Benefit Research Institute 2012 is even more disturbing. If we take a look at that married couple, and again looking at the savings needed for Medicare premiums and the out-of-pocket expenses in retirement, range from $283,000 to $567,000. That is catastrophic for many of our retirees. But having said that, Medicare is an extremely important piece of our retirees' projected benefits during retirement. Now, a couple characteristics that you already covered earlier in the presentations. Medicare is funded through FICA. That's Medicare Part A is funded through FICA, which is 1.45% by the employee, 1.45% of W-2 income by the employer. And there is no wage cap. Also, as you learn, there's a 3.8% Medicare surtax on net investment income above thresholds, and that's for individuals and couples over that threshold. And as you learn, for a couple, that's what, $250,000. If eligible for Social Security benefits, you are eligible for Medicare at age 65. That's the worker or the spouse. You're automatically enrolled in Medicare if you're receiving Social Security benefits. If not, you need to apply, and you want to do that 3 months prior to your 65th birthday. Also, Medicare is coordinated with the benefits from an employer, and Medicare is a secondary payer. Again, these characteristics were discussed earlier. But let's take a look at Medicare because it's such an important piece of our client's retirement picture. Part A, which requires no premium for fully eligible persons, and that's because it was funded with all those FICA contributions. Part A is for inpatient care in hospitals, nursing facilities, hospice, and some home care. Although there's no premium, there are inpatient deductibles and coinsurance pays, and the amount of those coinsurance is based on benefit periods, and we'll take a look at that in more detail in just a moment. Part B is for doctor services, hospital, outpatient care and therapy, lab, and durable medical supplies. There is a monthly premium, and again, there's annual deductibles and coinsurance based on benefit periods. This table, and I show the source of this table, I think does a nice job of outlining those concepts. Let's take a look at hospital inpatients. Again, the benefit period is 1 to 60 days, 61 to 90 days, and over that unless there's some reserve days. For days 1 through 60, those hospital inpatient costs are paid for, Medicare pays for 100% after the deductible, and you can see that in 2012 that deductible was $1,156. For days 61 through 90, Medicare pays for 100% of those costs after the co-payment, and as you can see, the co-payment is $289 per day. If there is a reserve days available from day 60 to 150, then again it would be $578 per day copay. After that, Medicare picks it up, and after 150 days, your client or you is paying 100% of the costs. So you start to already get that understanding that while Medicare covers a lot, there is a lot of out-of-pocket costs above and beyond that. You can follow the same description that we just covered there in terms of skilled nursing care, hospice care, and even pints of blood. Medicare coverage Part B, and as you know, there is that premium, there is an annual deductible, and here again there's cost sharing. For physician costs, 80% of the approved amount, 20% of the Medicare approved amount, plus up to 15% of the approved amount if the doctor does not accept that assignment amount. And you can start to see again, costs add up following down the table. Medicare A and B doesn't cover private duty nurses, skilled nursing care beyond 100 days, treatment outside of the United States, most dental work, most immunizations, cosmetic surgery, unless that is needed after an accident, routine foot care, eye and hearing exams, prescription glasses, or hearing aids. So as we go through these copays, these premiums, these deductibles, and what's not covered by Medicare, you start to understand why those large numbers are showing up on projected out-of-pocket healthcare costs for the retiree. Medicare supplemental insurance, Medigap. Supplemental healthcare insurance is sold to Medicare recipients by private insurers. These are insurers that are approved by Medicare. The idea here is that you're buying this supplemental insurance, and that's designed to fill in the gaps that Medicare coverage didn't pick up. That includes the co-pays, some of the deductibles, those periods beyond the benefit period. Various Medigap plans, each with a novel features. We'll take a look at a few of those in a moment. The monthly premiums are paid by the recipient. Premium costs depend on the plan features, the age of the enrollee, the area of the country, gender, and other issues. Now, this table from that same California Healthcare Advocates source starts to show different Medigap policies, A, B, C, D, F, G, K, L, M, and N. And as you go down the chart, you start to see what is covered. So, for example, Medicare A pays for all Part A hospital coinsurance, 100% of the additional hospital days for a lifetime maximum of 365. You see it picks up coinsurance for Part B. And as you scan this table and go down the list of benefits, you can see that you could select the type of supplemental plan which best meets your needs. Notice that last one, emergency care outside of the United States. So there are some supplemental policies which will provide that. So what is the cost of this? Well, it certainly depends on the plan you're selecting. However, it could easily be $700, $900 a month. And for a retiree, that might be sizable, but when you start comparing that to those $250,000 to $450,000 of out-of-pocket expenses, the Medigap policy might be really needed. And that answers this question. Why consider buying a Medigap plan at age 65? Well, just for that reason, to defray those sizable healthcare expenses which will accumulate given some repetitive healthcare surgeries, needs, drug costs, all those sort of situations. Those costs can deplete the estate. Delaying the purchase of Medigap will increase the premiums, and there's a possibility of being rejected. So the cheapest time to get that Medigap policy is right then at 65, not waiting until 75 or 80. And of course, you want to comparison shop among the approved providers because premiums can vary. Medicare Advantage Plan Part C. This is an alternative to Parts A and B. And as you see, Part C is offered by private healthcare providers. They tend to work much like an HMO or a PPO. There are premiums, deductibles, and coinsurance. It generally combines the benefits available through Parts A, B, and D, and why maybe your overall coverage, the options available to you would increase when getting Part C rather than Parts A and B. Part D, prescription drugs. You've probably heard a lot about prescription drugs in the last campaigns and readings because this can be a sizable out-of-pocket expense for the retiree. Part D offers prescription drug plans that are approved, Medicare approved, and they're offered through private insurance companies. There's an annual enrollment period. That's usually that November, beginning of December period. If you do join a prescription drug plan, there's annual premiums, deductibles, and coinsurance. And the amount of those premiums, deductibles, and coinsurance depend on the plan type selected. Other key concepts with Part D is a benefit limit, a donut hole, and you may have heard that. We'll look at that in a moment, which is going to phase out by year 2020, and threshold amounts. Again, you want to comparison shop. And when you're doing that, one of the issues that you need to assess when looking at the cost benefit is you will look at the current prescriptions being taken by you or your client and compare that to the drug formulary list of the provider. That's because different pricing on the different types of drugs. And again, there'll be different plans offered by the same provider, and it's not always the most costly plan which is the most effective. You take a look at the entire package, and depending on the drugs being taken will depend what type of plan you might be looking at. Well, again, I said the annual enrollment period, premiums, deductibles, coinsurance, and as I just said, checking out the drugs being used in the formulary list. Well, on this table, you start to see that there's, in this case, an annual deductible. In this example, $320. You can see that the plan pays 75% up to $2,610. The cardholder is paying 25%. Then it moves into that donut hole where the drug costs are being paid by the recipient or the cardholder. And then after that, you can see a lot more of the drug costs are being picked up by the plan, in this case, 95%. So that's what you'd be looking at when you're doing the research on the prescription drug. You sign up for Medicare. You can go on the site, www.medicare.gov. You can give them a call. They're very helpful. Again, you would automatically be enrolled in Medicare if in fact you're receiving Social Security. If not, you want to go here and sign up. Give yourself 3 months prior to age 65. In this presentation, you learned about Medicare insurance parts A, B, C, and D, supplemental Medigap insurance, and we looked at that in the context of working with your retiree client, knowing that these costs can really add up, and there's some advantages to looking at Medigap and starting to plan out for those supplemental costs.